Hi, everybody. I'm excited to be here today. Uh, Thank you, everybody, for being here. I appreciate everybody's presence. Um, like I said, today we're going to be talking about universal health and Cuban internationalism. I want to give a shout out to U.S. Hands Off Cuba Committee, not just tourists and global health partners, for their constant solidarity with Cuba and sending medical supplies to Cuba to help the Cuban medical system, the public health system. Again, I'm the founder of Pan American Medical Association, and my name is Dr. Uriel Ramirez. I want to ask a question to you guys. With the show of hands, does anybody here believe that health is a human right? And have you experienced or seen health as a human right? Either if you're from the US or from another country, I would like to know in the comments. Please interact with me so I can uh, figure out if anybody has any association towards health as a human right. Okay, I'll give a brief introduction of myself. I'm Dr. Uriel Ramirez, a gold title Cuban-trained physician, graduated in 2023, originally from Los Angeles, California, and now training in Albuquerque, New Mexico under Dr. Errol Lobo and UNM Anesthesia Research. I am the founder of Pan American Medical Association, and over the next 5 minutes, I'll share how ELAM shaped my vision of medicine as a human right and how we can carry that forward as a legacy of Cuban internationalism. So over the course of my career, I've been asked, why ELAM? This question is asked to all of us as ELAM graduates. And basically, my story is when I was at 16 years old in Peru, there was a 7.0 magnitude earthquake that devastated Lima, and I was there. Cuban-trained physicians set up hospitals and comforted families. Their rapid response, compassion, and unwavering teamwork showed me that medicine built on solidarity truly looks like. That lived experience became a spark in me and led me to train in a system where internationalism and human dignity are at its core. Health as a human right in Cuba. In Cuba in 1976, it was written in the Constitution, healthcare is a guaranteed right for every citizen. It was amended in 2002 and 2019 and reinforced these principles and embedded equity in the health policy. For us to understand a little bit more about Cuba, 27% of the public health expenditure goes to healthcare. About 13.79% of Cuba's GDP goes to health. What does that mean? Well, the United States GDP is about $29 trillion. And so 13% of that would be 3 trillion. It would take $3 trillion to give healthcare to everybody in the United States. And with that said, that's reflecting the deprioritization of health in Cuba. Having endured serious injuries myself as a young American citizen without health insurance, I know the fear of being turned away. Cuba's model taught me that no one should face that alone. ELAM as social medicine and inclusive health system. ELAM's curriculum emphasizes community-driven prevention, not just in hospital-based treatments. Students rotate through rural clinics, learn epidemiology in the streets, and design interventions with local leaders. There's a certain curriculum that we do. We do analysis de la comunidad and ASIS, that we're able to communicate with leaders in the community and then form a plan of action and then commit to the community as we approach them as partners. You know, patients are approached as partners and as a health collective. And so I'm continuing that legacy through the Pan American Medical Association. So currently, we coordinate shipments of essential supplies and PPE and medications and diagnostic kits to Cuba. I I graduated in a different era than Dr. Beku. Um, we I basically passed the pandemic in Cuba, and we saw the scarcity that was lived in Cuba at the moment, and medical supplies were at a scarcity, surgical supplies, equipment, ventilators, basically were non-existent in Cuba. And so I took it upon myself in the middle of my career to start bringing medical supplies to Cuba. And this year was finally the year that I was able to send $500,000 worth of medical supplies to Cuba with the help of U.S. Hands Off Cuba, Global Health Partners, and Not Just Tourists. Also, we also send ultrasounds to Guatemala. We currently sent about 2 ultrasounds to Guatemala, where Dr. Eliseo at this moment is working in a rural community in Guatemala and seeing over 300 patients with his ultrasound. And we also partner up with the SME ELAM, so Sociedad Médica Internacional, and we sent stethoscope to ELAM students in Cuba. So with all said, this is part of the Cuban internationalism that we bring with us and take with us on forward. So we stand united with Cuba's medical community, reinforcing our shared commitment to health as a human right. And so I want you guys to mark your calendar because we're gonna send another shipment of supplies in September with LA Hands Off Cuba. And we're gonna also send with Not Just Tourists and Global Health Partners. We're about to send another 40-foot container over there. And the needs are always necessary along with the pacemaker campaign. And so we're just trying to help as much as we can Cuba right now and its Cuban internationalism. So I would like all of you to guys to partner with us through donations, advocacy, or volunteer to ensure that life-saving resources reach those in need, most in need. And thank you for everybody that's here today and your solidarity. And we appreciate you being here today and helping us in our campaign. Thank you, and that's it.